This talk is an overview of psychotropic medications commonly used in psychiatric practice. A psychotropic medication, or simply a psychotropic, indicates any medication that has an effect on a person's mental state. First, let's outline the major classes of psychotropics, which include antidepressants, which are largely used to treat depression, anxiolytics for anxiety, mood stabilizers, mostly used for mania, antipsychotics, mainly used to treat psychosis, sedative hypnotics for sleep, stimulants and related medications for ADHD symptoms, and medication-assisted treatment for substance use. There's also another group of medications you should be familiar with as a psychiatrist, which I call secondaries. These are any medications used to treat the side effects of a primary psychotropic medication. Hence, they are secondary medications. Next, for each of these classes, I'll outline subclasses of medications, along with examples. Don't feel that you need to memorize all of these names now. Just get a sense for the different options you have in each of these classes. For the antidepressants, there are the selective serotonin reuptake inhibitors, or SSRIs, serotonin and norepinephrine reuptake inhibitors, or SNRIs, and atypical antidepressants. There are also two older classes of antidepressants, the tricyclic antidepressants, or TCAs, and the monoamine oxidase inhibitors, or MAOIs. Finally, there are the serotonin modulators, a relatively newer class of antidepressant. Next are the anxiolytics. Anxiety disorders are largely treated with the same medications used to treat depressive disorders, that is, the antidepressants. However, patients with severe anxiety or panic attacks may require PRN medications, which are as-needed, in-the-moment medications that can be used to stymie acute anxiety or panic. Such medications, organized approximately from least to most dangerous, include antihistamines, beta blockers, GABAergic medications, also known as gabapentinoids, and benzodiazepines. Next are the mood stabilizers, the most common of which are lithium, lamotrigine, valproate, and carbamazepine. There are many nuances to using each of these medications, which goes beyond the scope of this talk. However, one simple way to distinguish them is based on their distinct toxicity profiles. For example, lithium is toxic to the kidneys, lamotrigine to the skin, which refers to the risk for rash and Stevens-Johnson syndrome, valproate to the liver, and carbamazepine to the blood, which refers to the risk for agranulocytosis. Next are the antipsychotics, which include the first generations, second generations, and third generations, each of which have distinct mechanisms. Clozapine is a second-generation antipsychotic, but I place it in a separate class here due to its distinct characteristics, particularly its higher efficacy and higher need for monitoring of side effects. Next are the sedative hypnotics, a heterogeneous class of medications with various mechanisms of action that all are used to promote sleep. These include melatonin and the melatonin agonist Ramelteon, trazodone, an atypical antidepressant, doxepin, a tricyclic antidepressant, and zolpidem, a GABAergic medication. Next are the stimulants, and related non-stimulant medications used to treat ADHD symptoms, alpha agonists, norepinephrine reuptake inhibitors, and various stimulants in both immediate release and extended release formulations. Next are medications used as medication-assisted treatment for substance use disorders. These usually exert their therapeutic effects by agonizing or antagonizing receptors that substances of abuse typically bind to, such as nicotine and opioid receptors. Finally, we have the secondaries, including benztropine and propranolol for extrapyramidal side effects of antipsychotics, and VMAT inhibitors such as valbenazine for treatment of tardive dyskinesia, another potential long-term side effect of antipsychotics. That's the end of this talk. Again, this talk is meant to be an overview to help you organize your thoughts around what psychotropic medications exist. Future talks will explore each of these classes in further depth and discuss their pros, cons, and other nuances. Thank you.